10 silent symptoms of diabetes you must never ignore. Diabetes mellitus is a metabolic disease that causes high blood sugar. In this condition, your body either doesn't make enough insulin or can't effectively use the insulin it makes. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. If this malfunctions, you may have diabetes. Untreated high blood sugar from diabetes may damage your nerves, eyes, kidneys, and other organs. It often grows quietly. That's why people don't even suspect it until some visible symptoms are present, such as slow wound healing. But spotting the early signs of diabetes and getting prompt treatment is crucial and may save a person's life. In today's video, we will delve deeper into the 10 symptoms of diabetes that you need to be aware of to protect your health. Also, stick to the end of the video to learn about the foods that may help you deal with diabetes. Let's start. 1. Increased thirst and frequent urination. Excessive thirst and urination are conditions technically known as polyuria and polydipsia. In a healthy body, the pancreas produces insulin, which helps cells absorb glucose from the bloodstream. However, in diabetes, this process is disrupted. In type 1 diabetes, the pancreas doesn't produce enough insulin. In type 2 diabetes, the body's cells don't respond properly to insulin, a condition known as insulin resistance. Because of these disruptions, glucose builds up in the bloodstream, leading to high blood sugar levels. The kidneys then work to filter and absorb the excess glucose. When there's too much glucose for the kidneys to handle, they excrete the excess into the urine, pulling large volumes of water along with it due to osmosis. This results in a large amount of urine, which is why individuals with diabetes find themselves needing to urinate frequently. As a consequence of losing more fluid than usual, the body becomes dehydrated, which triggers the brain to signal thirst. This is why people with diabetes often feel excessively thirsty. Essentially, the body is trying to replenish the lost fluids. A study of adults living in London found that 65% of participants experienced increased thirst and urinary frequency when diabetes surfaced. 2. Unexplained weight loss. In diabetes, especially type 1, the pancreas fails to produce sufficient insulin, the hormone that allows cells to absorb glucose from the bloodstream and use it for energy. Without enough insulin, the glucose stays in the blood rather than entering cells. Starved of their primary energy source, the body's cells then seek an alternative. This leads to the breakdown of fat and muscle tissue, which the body starts using for energy, a process that results in weight loss. Moreover, this weight loss may pose a serious threat. According to an analysis compared with patients who did not experience weight loss, patients who lost about 5 kilograms had a higher risk of diabetic nephropathy, putting their kidneys at risk. 3. Fatigue. During an in-depth analysis with about 360 insulin-treated diabetics, tiredness was ranked 5th of the 16 most commonly reported symptoms. Insulin is vital because it helps glucose enter the cells, where it's converted into energy. When there is diabetes, this process is impaired, causing glucose to accumulate in the blood rather than serve as cellular fuel. This mismatch not only deprives the cells of essential energy, but also makes blood sugar levels spike or drop, both of which may make a person feel wiped out or lethargic. Complications related to diabetes, like kidney disease or nerve damage, may also exacerbate tiredness. The body's effort to cope with these issues, from cellular repair to altering blood flow, requires significant energy, thus draining stamina further. Furthermore, high blood sugar may lead to increased urination, which may disrupt sleep, a vital restorative process, making fatigue worse. 4. Blurred vision. Blurred vision is a common symptom for people with diabetes, and it often relates to how the body handles blood sugar levels. If blood sugar levels fluctuate frequently, it may repeatedly cause the lens of the eye to swell and then shrink back, making it hard for the eye to stabilize and maintain clear vision. Over time, this may lead to more permanent changes in the eyes if not managed well. Additionally, diabetes increases the risk of glaucoma, a group of eye diseases that may cause vision loss and blindness. where increased pressure in the eye may damage the optic nerve, potentially leading to blindness. This risk is heightened as the delicate blood vessels in the eye are more susceptible to being damaged due to high blood sugar levels, which may increase eye pressure. Another serious complication is diabetic retinopathy, the most common diabetic eye disease. It occurs when abnormal blood vessels grow out of the retina and block fluid from draining out of the eye. Initially, this may cause mild vision problems, but it may eventually lead to blindness if left untreated. 5. Slow healing of cuts and wounds. High blood sugar levels, a common symptom of diabetes, may damage blood vessels over time. This damage means that less blood reaches different parts of the body, including any wounds. Blood is vital for healing because it carries oxygen, nutrients, and immune cells to the wound site to repair the tissue and fight off any infections. In addition to affecting blood flow, high blood sugar levels may also weaken the immune system. A weakened immune system struggles to efficiently tackle infections at the wound site, making it easier for infections to develop and harder to get rid of them. This further delays the healing process as the body has to fight off infection in addition to repairing tissue. It is estimated that impaired healing of diabetic wounds affects approximately 25% of all patients with diabetes mellitus, often resulting in lower limb amputation, with subsequent high economic and psychosocial costs. 6. Tingling, pain, or numbness in the hands or feet, neuropathy. Diabetes may lead to a condition known as neuropathy, which is damage to the nerves. When blood sugar levels remain high for a long time, they may cause significant and direct damage to the nerves throughout the body. This nerve damage arises because excess glucose in the blood interferes with the nerve's ability to transmit signals. Additionally, high blood sugar may weaken the walls of the small blood vessels, capillaries, that supply the nerves with oxygen and nutrients, further impairing nerve function. Distal symmetrical neuropathy, which is a slowly progressive condition, is the most common, accounting for 75% of diabetic neuropathy. The most common type of diabetic neuropathy is peripheral neuropathy, which primarily affects the nerves in the feet and legs and less frequently the hands and arms. This leads to symptoms such as numbness, tingling, pain, or weakness in these areas. Because of the numbness, injuries to the feet may go unnoticed, leading to infections and other complications. Another type of diabetes-related nerve damage, autonomic neuropathy, affects the nerves that regulate automatic bodily processes like digestion, heart rate, and blood pressure. This may lead to a range of problems, including digestive issues, sexual dysfunction, and irregular heartbeats. 7. Gum disease and other dental problems. When diabetes is not well managed and blood sugar levels remain high, it may reduce the flow of saliva. Saliva is crucial for cleaning the mouth and controlling bacteria. With less saliva, the mouth becomes dry, known as xerostomia. This dryness may lead to soreness, ulcers, infections, and tooth decay because there's less saliva to wash away food particles and neutralize acids produced by bacteria in the mouth. Furthermore, the compromised ability to combat bacteria may lead to gingivitis, a mild form of gum disease characterized by inflammation of the gums. If left untreated, gingivitis may progress to a more severe gum disease called periodontitis. Periodontitis affects the tissue and bones that support the teeth, leading to tooth loss in severe cases. A study found evidence that people with diabetes are at a higher risk of oral thrush infections. 8. Darkened skin in creases and folds, Acanthosis nigricans. Acanthosis nigricans is a skin condition often associated with diabetes, particularly in cases where the diabetes is not well managed. This condition is characterized by dark, velvety patches that usually appear in the body's folds and creases, such as the neck, armpits, and groin. In people with insulin resistance, the body needs to produce more insulin to make glucose available to cells. This excess insulin, along with changes in other related hormones, stimulates skin cells to grow abnormally. The result is the thickened, darkened patches of skin characteristic of Acanthosis nigricans. According to a study, Acanthosis nigricans was present in about 20% of 1,730 patients. In fact, research says patients with this skin condition are twice as likely as those without it to have type 2 diabetes. 9. Frequent infections. Chronically high levels of blood sugar may cause dysfunction of the immune system. High glucose levels in the blood and tissues provide an ideal environment for bacteria, fungi, and viruses to thrive. For instance, yeast infections are more common in people with diabetes because yeast feeds on glucose. This is why areas of the body that may trap moisture, such as the mouth, armpits, and genital areas, are particularly susceptible to infections. Additionally, diabetes may cause damage to the blood vessels, which reduces circulation. Poor circulation means that less blood reaches the extremities, like the feet, which decreases the supply of immune cells and nutrients needed to fight off and heal infections. This is why people with diabetes may have a harder time healing from infections, and why something as simple as a foot ulcer may become a serious problem. Furthermore, high blood sugar levels may interfere with the function of white blood cells. These cells are the body's main tool to fight off infection. Elevated glucose levels impair the ability of white blood cells to move to the site of an infection, engulf harmful bacteria, and kill them. 10. Increased hunger. The classic symptoms of diabetes, such as polyphagia or increased hunger, occur commonly in type 1 diabetes, which has a rapid development of severe hyperglycemia, and also in type 2 diabetes, which has very high levels of hyperglycemia. When cells don't receive enough glucose, despite there being plenty of it in the blood, the body perceives that it's not getting the energy it needs. This lack of glucose utilization by the cells triggers a state of perceived starvation. As a result, the brain signals the need to eat more to obtain the energy it thinks it's lacking, leading to increased hunger. Additionally, in people with diabetes, particularly type 1 diabetes, the lack of insulin also means that the body begins to break down fat and muscle for energy, which releases ketones into the body. This breakdown of bodily resources may further increase hunger. Now, let's learn more about diabetes. Diabetes is a chronic condition characterized by high levels of glucose, sugar, in the blood. It progresses through various stages, each with its own set of issues and complications. The main types of diabetes are type 1, type 2, and gestational diabetes, but the progression typically discussed relates most often to type 2 diabetes due to its gradual onset and lifestyle-related factors. 1. Prediabetes. Prediabetes is the initial stage where blood glucose levels are higher than normal but not yet high enough to be diagnosed as diabetes. Many people in this stage do not have noticeable symptoms, making it hard to detect without screening. However, without intervention, many people with prediabetes may progress to type 2 diabetes. The main issue at this stage is that the higher than normal sugar levels may start causing damage to the cardiovascular system and nerves. 2. Type 2 diabetes early stage. In the early stages of type 2 diabetes, the body begins to resist the effects of insulin or doesn't produce enough insulin to maintain normal glucose levels. Symptoms might start to appear, which may include frequent urination, increased thirst, and increased hunger. Early detection and treatment may manage these symptoms and help prevent more severe complications. 3. Type 2 diabetes established. As diabetes progresses, the continued high blood sugar levels may lead to various complications. These include serious damage to the eyes' diabetic retinopathy, kidneys' diabetic nephropathy, and nerves' diabetic neuropathy. And cardiovascular disease risk also increases significantly. 4. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body attacks insulin-producing cells in the pancreas. It may develop quickly, and management must begin immediately. Unlike type 2, type 1 is not typically associated with lifestyle factors and progresses from insulin dependency due to pancreatic beta cell destruction. Patients need lifelong insulin therapy and close monitoring of blood sugar levels to manage the disease and prevent complications. 5. Gestational diabetes. Gestational diabetes occurs during pregnancy and usually resolves after giving birth. However, it increases the risk of developing type 2 diabetes later in life for both the mother and the child. It's important for pregnant women to manage their glucose levels to avoid complications during pregnancy and at delivery. Add these foods to your diet to deal with diabetes. Here is a list of foods that may help manage different symptoms of diabetes while keeping the blood sugar level in check. 1. Cucumbers. Cucumbers may be particularly helpful for managing increased thirst and frequent urination, common symptoms of diabetes. Being naturally high in water content, cucumbers aid in hydrating the body. This hydration is crucial as it helps compensate for the fluids lost due to the frequent urination that occurs when blood sugar levels are high. 2. Avocados. Avocados are beneficial for countering unexplained weight loss in diabetics. They are rich in healthy fats and calories, which may help stabilize and increase body weight while providing a sustained energy source. The monounsaturated fats in avocados also help with blood sugar control by slowing down the digestion process, which may prevent blood sugar spikes. 3. Oats. Oats are excellent for combating fatigue associated with diabetes. They have a low glycemic index, meaning they provide a slow and steady release of glucose into the bloodstream. This helps maintain consistent energy levels throughout the day, avoiding the highs and lows in energy that may lead to feelings of tiredness. 4. Spinach. Spinach is packed with lutein, a nutrient known for its eye health benefits, which makes it a good choice for those experiencing blurred vision due to diabetes. Regular consumption of spinach may help improve the overall health of the eyes and mitigate some of the vision impairment caused by diabetic conditions. 5. Walnuts. Walnuts are rich in alpha-lipoic acid and omega-3 fatty acids, which are beneficial for those experiencing neuropathic symptoms, such as tingling, pain, or numbness. These nutrients help improve nerve function and reduce inflammation, which may alleviate some of the discomfort caused by neuropathy. 6. Green tea. Green tea, known for its anti-inflammatory and antibacterial properties, may be effective in managing gum disease and other dental problems in diabetics. The catechins in green tea help reduce inflammation in the gums and combat bacterial infection, which may lead to healthier teeth and gums. 7. Whole grains. Whole grains may help manage the skin condition Acanthosis nigricans, often seen in diabetics, due to their ability to improve insulin sensitivity. By reducing insulin levels, whole grains help diminish the skin changes, such as darkening and thickening, that occur with this condition. 8. Garlic. Garlic has natural antibacterial and antifungal properties, making it an excellent food for diabetics prone to frequent infections. Regular consumption of garlic may help strengthen the immune system, making it more capable of fighting off infections, which diabetics are more susceptible to. 9. Legumes. Legumes, such as lentils, beans, and chickpeas, are high in fiber and protein. They are particularly effective in controlling increased hunger, a common issue for those with diabetes. The fiber and protein help regulate blood sugar levels and slow digestion, which helps reduce hunger pangs and promotes a feeling of fullness for longer periods. Recognizing these symptoms early is crucial for managing and potentially reversing the effects of diabetes. If you experience one or more of these symptoms, consult a healthcare provider for a proper diagnosis and to discuss your options for managing your blood sugar and preventing further complications. Early intervention may drastically improve the quality of life for those with diabetes. Today, we learned about all the symptoms that you may experience when you have diabetes. But did you know that there are other signs that your health might be at risk? Want to find out more? Watch 11 bad daily habits that are ruining your liver. Or watch 12 bad daily habits that are destroying your kidneys. You may watch either or both of them. Do you know any other symptoms of diabetes that were not mentioned earlier? Let us know in the comments section below.